Hi everyone. This week we're going to talk about medical emergencies. So I get asked a lot by friends, family, this is happening to my child or this is happening to my baby. Should I be worried? Can we watch it? Can we sleep and get it addressed tomorrow? So I just thought, let's just talk about these things. How do you know when you can watch and observe your little one if they're not well, or when should you actually get out of the house immediately or call for help? So what is a medical emergency? There's different definitions, but essentially a medical emergency is an illness or an injury that is serious, number one, and unexpected, that you think could possibly endanger your child's life or cause future long-term damage to your child's life. So essentially that's what we would call a medical emergency. But as a mom at home, how will you know? I mean, children get sick all the time, they cough, they have runny tummies. How do you know that, my child is fine or I really should get some help? So I've got some tips for you. Some are like well-known documented things such as the danger signs. So I think we'll start with those. Okay, so what are danger signs? These are common signs that are taught to clinicians, nurses, everyone really who works in the health system, to know that if a child is presenting with any one of these things, you need to act now. You can't send a child like that home and say, oh no guys, come back tomorrow, or continue to observe. So number one is if a baby or infant or toddler is unable to tolerate any solids or any feeds. So if it's a breastfeeding baby and they are not drinking their milk at all, they're not wanting to suck the breast, or if they're bottle fed, they are not wanting to take in any of their milk, then that's a danger sign. And even in a bigger child, if they don't want to eat anything, not eating or drinking anything, you need to worry. And I mean, I'm not talking about like skipping a meal, or refusing that one bottle. I would wait, but see for a few hours. I mean, in a small baby, let's say a baby under a month, not drinking anything for about 6 hours would be a serious concern, because these babies drink every 3 hours. So not tolerating any feeds is a danger sign. And then in a child who is maybe vomiting everything. So not just food. So you give your child a meal, they vomit, everything comes out. You try liquids, everything comes out. And then let's say you try some rehydration solution. So there's ways to make those at home. If you don't know, it's a liter of boiled water cooled down with 8 teaspoons of sugar and half a teaspoon of salt. So you mix that, and that's a normal good quality rehydration solution. It's got a little bit of salt, so they don't really like the taste of it. But otherwise, you can get Rehydrate or something like that from a pharmacy. So if you're giving your little one that as well, and they're vomiting all of that out, so as in nothing, absolutely nothing is staying in, then I would take my child to an ER or to a doctor or clinic for them to get assessed. So not eating, not tolerating any fluids, vomiting, everything. These are danger signs. If your little one has a convulsion, so this is a seizure, so they can present in different ways in different children. So if your child starts shaking the entire body, or their eyes roll, in little ones, they can also just twitch. So something you've never seen before that your baby's suddenly doing, like they can twitch the corner of their mouth, or like an eye can just twitch and your baby's like staring into space. So that's called a seizure or a convulsion. That's an emergency. You don't stay home with your little one waiting to see when they're going to wake up and if it's going to happen again. You need to get somewhere where you can get medical attention. So we worry about convulsions. And then close to convulsions is lethargy. So lethargy is basically when a child is very tired, like an unexplainable type of fatigue, like you're struggling to wake your baby up. They are struggling to keep their eyes open. And this is a child who slept. So they've had a good night's rest. They've done nothing during the day. They've eaten or whatever. Like it's been a normal day. Nothing excessive has happened. But for some reason, your little one just will not wake up. You can't get them up. You've tried different things, even if they're breathing, but they are just very, very drowsy and difficult to wake up. And this is something, if a situation like this is continuing for like, for me, over 2 hours of that, I would be concerned. So I think you should get your little one checked if that happens, you know. But there's some few questions you can ask yourself. I mean, if your little one hasn't had anything to eat all day, they could be hypoglycemic. So that means their sugar levels could be low, or they could be dehydrated, you know. So, I mean, you'll troubleshoot those things and you'll ask yourself certain questions like, has my baby been sick over the past few days, you know? So this could be a progression of an illness. And I think as a parent, you know your child, you know, you don't need somebody else to tell you that your child is drowsy or excessively lethargic. If in your gut you feel like, no, there's something not right with my little one, don't sit, don't wait, don't get someone else to confirm if your gut is right or wrong. Go get your child checked out. Let it be us who tell you like, hey, mama, don't worry, you know, maybe your child didn't sleep well last night, whatever, but rather get your child checked. So we've said vomiting, not able to drink or tolerate, convulsions, lethargy. I feel like I am leaving out one, but it'll come with me. It will come to me with time. Okay, so at least those are danger signs that we absolutely worry about, everybody worries about. And then I think for moms with newborns, so this is a baby who is from day one of life to 30 days. Some people even go all the way up to 6 weeks. Fever for me is concerning, okay? So I really feel like every household that has children should have a thermometer that you can measure your child's own temperature with. Yeah, like to me, when you say, oh, my child just feels hot, I put my hand on their forehead or on their tummy and watch his, for me, that's not fever. So you need to actually measure it with a thermometer. You can get those at any pharmacy. And in little ones under a month, a temperature above 38 degrees for me is concerning, and I would rather you get that little one checked out, okay? Because that could be an infection, could be a virus, it could be a bacteria, but who's to know? And it could be something insignificant or it could be something very serious. So fever in a newborn for me is a serious thing. In a bigger child, yes, then you can observe and you can ask yourself all these other questions. Do they have danger signs? Are they uncomfortable? Because also fever is just, it's a sign that your child's immune system is fighting something, right? So it's not necessarily a bad thing. But if the temperature becomes too high to the extent that your baby's body can't cope with it, a complication of something like that could be febrile convulsions. So your little one could get so hot that they actually start having seizures. Then that is a medical emergency, and then you need to take them to the emergency rooms. Okay, so those are general danger signs, and then we've spoken about the newborns. And then let's just talk like generally. Say your little one has a flu or a cold or whatever you want to call it, and they've been coughing for some days, blocked nose, but maybe they're still eating, you know, they're managing to sleep, you're coping with their temperature, so the fever's not too bad, but maybe they're starting to breathe a little bit funny, and you're not sure, like, is this okay or is it not? So I would say you should get help if the breathing becomes noisy. So by noisy breathing, I don't just mean like mild snoring because the nose is blocked. I'm talking about like when it sounds like there's a frog sitting in your child's throat, you know. So we call this stridor. I'm going to try and like imitate the sound, but it won't sound anything like this. So if it's like, you know, if you're hearing something like that from your child, you need to worry. And then if you're seeing like that they're starting to use their neck muscles, so there's like strain up here, or the nose is flaring, so their little nostrils start sticking out as they breathe, or they're just breathing very, very fast, okay? And then if you also look in between their little ribs, you might see that the tissue in between the ribs is like sinking in. That's the muscles that are busy pulling as your baby's trying to breathe. For me, that means that that little one is struggling to breathe. And I think that unless you have a SATS probe or a SATS monitor at home, you won't know if your child's oxygen levels are actually dropping. So I would take that child to be seen by a healthcare worker. And then at the other extreme end of a little one who's struggling to breathe is if your child's color actually changes. So in light, in complexion babies, you might be able to see that like, the color around the lips is going a little bit blue. It's normally like pinkish. So if they start going blue on their lips or even their skin, or if you look at their nail beds go blue, then that child is in serious trouble and you need to get to a hospital. Okay, so those are other danger signs that you can then look out for on top of the previous ones that I've mentioned. Okay, and let me talk about ones that are not so common. So these are the ones that I think that parents might notice something, but then think like, I don't know if this is serious. I think this can wait till next week when we get a doctor's appointment, or not even think to get this checked out at all. I would encourage you that if your child has any one of these, to rather get them checked than not. Okay, so rather let it be us who says, no, this is nothing serious. Okay, so one of them is like if your little one has a new lump on their body, anywhere on their body. So I think any caregiver or parent should really get in the habit of learning their little one's body. So that's like at bath time or whenever, just like look at your child, you know, like don't just do things mechanically and routinely. Get to know the shape of your child's body, get to know their skin, where are their birthmarks, so that if in future there's something very different, you'll actually notice it. It won't take you like a month to notice that your little one has all these bruises on their back, just for example. I mean, also these days with children being abused by people, you don't want to miss things like that. So in that case, if you notice that there's suddenly like a lump on somewhere on the side of your child's neck, or if you're looking at their tummy and normally things are equal, but suddenly on the one side of the tummy, it's bigger than the other side. And then if you feel it, maybe you might actually feel something or not, right? Whether you feel something or not, but if there's a new swelling or a growth or a lump anywhere on your little one's body, I would get that checked out. And then secondly would be bone pain. So bone pain, if your child can talk, they'll tell you that like, oh mama, it's sore over here, or my knee hurts, you know. And I'm not saying that, you know, one day of a painful knee after your little one fell outside is a reason for you to rush to the hospital. I'm saying like a child where you can't trace it to any trauma, there was no wound, and this complaint is lasting for like a few days, you know. You may feel that area, whether it's a knee or elbow or shoulder or anywhere on the body over a bony area, if it's feeling warm or not. As long as your child is complaining that that area is painful and this is lasting over like more than 2 days, let's say, I would get that checked out. So bone pain is something that we don't take lightly, and we definitely want to make sure that we're not missing anything. And in the little ones who can't speak, then you just observe how they walk. So if your baby or child if they're starting to crawl or they can walk, if you notice like a new limp, they're not complaining. They're not saying, oh, I can't step on this foot, it hurts. But you see that like they are avoiding stepping on that ankle or on that knee. Or if it's a crawling baby, you see that they're reluctant to touch that joint on the ground. Then you need to worry. Or if when you touch them in that area, they cry. If you don't know what could have happened, rather get it checked than not, okay? So yes, aching bones, joints, lumps, swellings, and then like acute severe weight loss. If your child like loses a significant amount of weight, I won't even put a number to this because you will know. You will know that, no, my little one's lost weight. Clothes are getting loose and they're eating fine as far as I can tell. Or you can't explain it, like you just don't know the reason, but your child, you feel, or you're worried that they've lost a lot of weight. Rather get your little one checked out, okay? And then another one is if the color around the eyes changes. So where it's supposed to be white, if it suddenly becomes yellow, or you're not sure, you know, maybe it's not yellow, but it's a little bit yellow or like a little bit lemony, please don't chill at home. Bring the child to us, let's check it out. Let us tell you that, no, this is nothing, okay? And then any other changes in the eye. So if you had a child whose eyes were normal, as in equal, they could look at things parallel, and all of a sudden there's a new squint, one eye is going that way, or they're both going where they're not supposed to go. My brother calls it the independent eye. Yeah, that's probably not PC. So if that's the case, a new squint, you need to get that checked out. Okay. And then also headaches that persist, so headache today, again tomorrow, again the day after, not okay, not normal. I think rather get your little one checked out. So there's many conditions that I could say probably you should get your child checked on or not. But I think at least I've covered the most important ones, or at least the ones that I think could lead to a danger to a child's life if you don't get them addressed quickly. Yeah. So if you want to ask about other conditions, or you're not sure about a thing that you've noticed in your child, please, you can let me know. You can hit me up on my Insta in the DMs, or you can comment in the comment section. But I hope this has been helpful. Have a good week.
Mama.
Yes, baby. You want to read?